Okay. Good afternoon or good morning as folks are logging in. I will introduce myself and today's webinar presentation. Welcome back, everyone. I'm Bethany Hamilton, Director of the National Center for Medical Legal Partnership based at the George Washington University. You are joining us today on June 6, 2024 at 1 p.m. Eastern Time for a 90-minute webinar. That is a part of our Health Center MLP Planning, Implementation, and Practice webinar series, or we call it the MLP PIP webinar series. We are now in session 8 of the series, where we will be joined by a very special guest speaker who may look, sound, and would be familiar to many of you, to talk about crafting effective trainings to strengthen the Health Center MLP workforce. So welcome back, everyone. As noted on the screen, and if you've been joining us for this interactive webinar series, you are initially joining while on mute. But again, this is designed to be a smaller but highly interactive webinar series. So I want to encourage you all to utilize the question and answer Q&A pane in Zoom to be able to submit your questions, and then utilize the chat to also engage. And then also feel free to send us a message using the chat, those of us who are hosts and panelists, if you need some assistance. And then if you need to activate the captions in Zoom, click on live transcript under the More options tab and then show subtitle. We know that folks usually ask us this question: will the webinar be recorded and shared? Absolutely yes. All of the recordings and the archives of this webinar series are on the Medical Legal Partnership website under the resources section. And there's a special page dedicated to this webinar series. Additionally, under our housekeeping, we want to make note that the way we will be indicating to you all that we have an interactive point built into the webinar is using this icon that we've created. So typically on webinars, you don't get to unmute and talk. On this one, you do. And so you may see this icon appear on a slide when we want you to use the raise hand feature in Zoom. If it's not working for you, just send us a chat to let us know you want to raise your hand, be unmuted, and share a response to an interactive or engagement point. As a reminder, we are using a lot of alphabet soup, some of which is very specific, not just to this model, but the model of MLP as applied to health centers, a specific primary care setting that is by mission and mandate designed to support individuals with healthcare and enabling services who might be uninsured, underinsured, and in particularly socially vulnerable patient populations. So you'll hear us talk about these health centers as community health centers, or CHCs, that are funded by and administered by HRSA, the Health Resources and Services Administration, a federal agency. We may also refer to the specific grant types that they receive and are designated federally qualified health centers. That makes them eligible for different types of provisions under different statutory authorities related to Medicaid and payments. And then when they partner with legal aid organizations to form medical legal partnerships, or MLPs, they are often partnering with federally funded through a federally funded program that's administered by the Legal Services Corporation, or LSC. So that's some of the alphabet soups. If you're new, you're seeing this alphabet soup and tasting it for the first time. If not, my apologies for serving it up once again, but welcome back to our webinar series. This particular webinar series, again, is funded by HRSA, the Health Resources and Services Administration. The National Center is in its 10th year of funding as a training and technical assistance partner. However, I should note that despite the funding, the contents that you hear from our presenters on the series, or if they're sharing resources that they've authored, don't necessarily represent the views of or endorsed by HRSA. I've been noting this is a part of a webinar series. We've been partnering with Texas A&M's Institute for Healthcare Access on this webinar series. You all have seen Keegan Warren, as well as our additional partner, Jay Sicklick from UConn, presenting a lot of the content that we're using that draws from our Health Center MLP Toolkit. That's a resource that was created a few years ago and vetted by medical legal partnership practitioners from around the country. So it is a peer-developed embedded resource that we continue to use and disseminate to create this webinar content. Again, this is active learning, so please participate. Here's the first point of participation. We're going to launch a poll that we would like everyone to utilize to let us know if you are from healthcare, legal services, academia, or perhaps another type of entity. Or let us know if you are familiar or not with medical legal partnership. So do you have an MLP? Do you not have an MLP? Or maybe you're not sure. And then as it pertains to today's specific content, please let us know how and if you conduct medical legal partnership trainings. If you do, is it for your healthcare team? Is it for your legal services teams? Are you conducting trainings for all teams involved in the MLP? Are you not conducting trainings? Great, ever the more reason to be here with us. Or do you not find this question applicable because you don't have an MLP? Keep those coming in. We have about 86% participation. So just a couple more people and I'll close out in about 5, 4, 3, 2, 1. I'm going to end the poll and share the results. So as folks can see on the screen, we also have an even split between healthcare and legal services folks joining us today. So I want to thank everyone across the board for joining us. We have an academic partner joining us. Thank you as well. We know that academic MLPs are also growing. And all of you have MLPs. Great, excellent. Kate Marple joining with us today. I know we'll really enjoy speaking to those of you who have already established a medical legal partnership to find out how you are leveraging the additional activity that you that we often talk about MLPs getting done, and that is trainings. So for those of you who answered the question, your MLPs are conducting trainings for healthcare teams. About half of you said that. The other half said you're conducting trainings for all teams. No one answered yes to the second point. So no one said that they're conducting trainings for the legal services team as a part of their MLP. And then a couple of people said that their MLPs are not conducting training. So we'd love to hear from you all about those different levels of MLP training engagement. Thanks for participating. You can see from the slide on the screen where we are in terms of this series. And we have a couple more webinars coming up over the next few weeks to help close out the content. But here's where we are if you're tracking along with the MLP toolkit. We're really talking about how to develop trainings that help to strengthen that healthcare, or in this case, a health center workforce, and what are the benefits thereof. In today's webinar, we're hoping that everyone will take away the following in terms of learning objectives. We're hoping to help everyone identify common MLP training needs and goals. We're hoping that you'll also be able to demonstrate principles of adult learning and their relevance to medical legal partnership trainings. And finally, we're hoping that everyone will actually be able to apply training best practices within a medical legal partnership context. Again, I'm Bethany Hamilton. I'll be today's moderator. I'll be wrapping up my opening remarks very shortly. But as I noted earlier, we're partnering with Texas A&M University's Executive Director of the Institute for Healthcare Access, Keegan Warren, as well as Jay Sicklick, an adjunct professor of law at UConn and a former MLP director of a Connecticut-based pediatric MLP. So now it is with pleasure that I get to introduce you to today's subject matter expert and our special guest speaker, Kate Marple, who is principal consultant of Who Tells the Story. Those of you who are familiar with Kate Marple may know that she is the National Center for Medical Legal Partnerships former communications director and has been doing MLP for decades, helping us to advance the movement and create this environment and space where medical legal partnerships can thrive. So I want to reintroduce Kate Marple to the Health Center Medical Legal Partnership webinar series and field, and thank her for joining us today. We also have Reha Manikanasamy, the National Center for Medical Legal Partnerships data scientist, actually. So she's our senior research assistant and can provide support if you send her a quick email in case Zoom or the direct messaging doesn't work. Just send an email if you need some help on today's webinar or throughout the webinar series. If you joined us last week, you'll know that on session 7, we were joined by the legal health team along with their partners at New York City Health and Hospitals to talk about this achievement finally in getting their MLP to be integrated into the EMR, or the electronic medical record system. We know that a lot of medical legal partnerships around our country are still trying to increase the efficiencies and effectiveness of their work by integrating and exchanging data through the EHR or EMR. So these were the learning objectives that we covered. Understanding the impetus for building MLP referrals in the EMR, and nuts and bolts on how their particular system was built, which is based on Epic, and then the lessons learned and next steps that they plan to take in continuing to leverage this EMR integration. On today's session, however, and I'll turn it over to Kate Marple, this is where we're finally getting to do that deeper dive into this other aspect of medical legal partnership work that we mentioned, and that's trainings to really strengthen that healthcare workforce or the health center MLP teams. Kate, I will now turn it over to you, and thank you again for joining us on today's important part of our webinar series. Thank you.
Thank you so much, Bethany. And hi, everyone. It's so good to be here with you today, and especially to talk about training. This is one of my favorite aspects of medical legal partnership. And it's also just one of my favorite things in general to talk about training, especially cross-sector training. So I'm really excited to be here. As Bethany mentioned, I'm the former communications member. Oh, we can actually go back to the slide we were just on. I'm the former communications director of the National Center for Medical Legal Partnership, where I actually also did had a really heavy focus on training, built a lot of trainings for frontline teams. And even though I'm now off doing a lot of storytelling work and other things, I still work with the legal aid and healthcare worlds a lot to craft trainings. I actually just finished building a housing training series for medical legal partnership that we'll get to spotlight a little bit later. I just wanted to give you a sense of how this training session is going to flow today. I really think about it in 2 parts. For the first half of it, we're going to talk a little bit about training in the medical legal partnership context real specifically. So we're going to talk about what are the topics that are most common or most needed to be trained on, what are the venues that are really important for training in the medical legal partnership world. What's the purpose really of training? How does it serve the larger partnership? Introduce a couple of resources that you can take and adapt if you want to in your own work. And then in the second half, we're going to talk about my favorite thing, which is medical legal partnership aside, how do we craft an effective training? What makes training really good for the audiences we meet with? So we're going to talk a little bit about very briefly about adult learning principles. And then I'm going to give you both just sort of a little framework and a worksheet you can take away from this session and use to sort of think through any training you're trying to build and how to make it more as effective as possible. So really excited to do all of this with you today. So if we can go to the next slide, where I wanted to start was with hearing a little bit from you. So I saw from the poll that you all have medical legal partnerships, and almost all of you are training in some capacity for different audiences. So I really want you to just sort of think about the work you're doing and how you think about training topics. And I want you to ask yourself both, what do you wish your partners could help you understand? So when you think about training, what is that training you're seeking out from your partner, or whether you're getting it or not getting it currently, what's that thing that your partner could most help you understand? So if you're a healthcare team member, think about, what are you looking to the lawyers for to help you understand meeting patients' SDOH needs, or how you work with the legal teams? And if you're a legal team member, what are you looking to your healthcare partners to help you understand or do, whether that's working in a health center environment, better understanding that, or whether it's something about how they can help you meet clients' needs. So think about, what do you need from your partner? And then the second thing is, what's one thing that you, through doing this work, think that your partner needs to better understand in order to do this work? So a really simple way of saying this is, what do you think you have to most learn, and what do you think you have to most teach within this partnership? And I would love to hear from a couple people. So if you could actually raise hands, and we'll unmute you, and you can weigh in that way. So take a minute, ponder it. and then throw a hand up when you're ready. And again, this might be something that you currently receive training on. So it might be a topic you're already receiving or leading trainings on, or it might be something that you are yet to develop a training on. And if you're having trouble for any reason raising your hand, you can also put answers into the chat box. All right, I'm seeing a couple hands go up. Let's start with Emily Adams. Hi, Emily. Can you let us know where you're calling in, or like where you work, on which side of the partnership, and your answers to these questions?
Yes. Can you hear me?
Yes. Hi.
Okay. Hi. So I'm an attorney with a medical legal partnership, and something that I usually rely on my medical partners for is to explain what a diagnosis means and what like how how that can impact a child. I practice education law and public benefits, so but I most typically rely on providers for education work. And so I understand that a lot of my clients have certain diagnoses and things like that, but I need help understanding like what that diagnosis means in terms of how they function and access their education. So that's one thing. And one thing that I hope that my partners would need to better understand would be oftentimes we get referrals where doctors will say, well, if the public school can't meet your needs, then they can go to an alternate setting. But that is, so we will often get clients who come to us and say, we don't like this school district, help us get into a private school. And that is really hard to do. And so it's hard when a client comes with like super high expectations as to what we're able to do based on the law. So that is something that came to my mind.
Thanks, Emily. So I know that you specifically work in education law, but I hear within your answers some really broad themes as well, right? Which is like understanding how diagnoses affect potentially someone's legal issue, but just also how to work with a patient. And then I'm also hearing sort of helping on your side, helping to manage, helping healthcare partners to understand what you can help with specifically, and then in turn managing patients' expectations about legal services, which applies to any topic. That's great. Thanks so much, Emily. I see that Lauren also has a hand up. Lauren, if you'd like to unmute and share with us and let us know what organization you're joining us from.
Sure. My name is Lauren Utri. I am a pediatrician in a children's hospital in Portland, Oregon, and we have a hospital-based medical legal partnership. Emily, I loved hearing what you had to say. I can relate to what you want to learn and what you want to teach. On the medical side, I think something that's really helpful from our legal partners is, I guess it's an experiential learning process. So what is it like for families to experience legal health challenges in the realm of social and legal determinants? And what is the process of law for tackling some of those challenges? And experientially, I think this goes into what something I love teaching is, I think we really, on the medical side and on the legal side, we really need to be physically present in each other's spaces in order to break down these silos and understand these issues. So.
Wonderful. Thank you so much, Lauren. I love the call out to experiential. I love how you raised not just the specific topics, but sort of the way in which we learn from each other, that the more we spend time with each other, the more we physically walk through the clinic or go to the spaces where our patient clients are, where our partners are, the more we like see it all unfold, right? And so this is why the more that we are on site together, in rooms together, observing each other, it's almost as important as the content. And I love that call out. And I also love the call out to what the legal journey of a patient is after they're referred to legal services, and actually have a late breaking new resource to share with all of you on that exact topic as we move through this, an actual training and resource that have been built that you can adapt if it's helpful for you all. This is great. Thank you. Thank you so much for sharing. So let's go ahead to the next slide. And so I wanted to just recap some of the biggest training needs that I've seen, both during my time at the National Center and since, in working with teams, and things that I hear come up over and over again. So from healthcare team members, the three biggest things that I hear are like, how do I spot different legal issues, and when do I need to make a referral, right? So we're not, I always say, we're not trying to make lawyers of our healthcare friends, right? We're just trying to figure out, and I know they're trying to figure out, how do I spot something and get someone to the right help that they need? I always like to quote the former medical director of the National Center for Medical Legal Partnership, Dr. Megan Sandel, who always used to say, as a pediatrician, she was a primary care pediatrician, she used to say, I don't need to know all the different types of heart murmurs. I just need to know that something sounds off with my patient's chest, like with their heart, and that I hear a murmur. I don't need to know what type of murmur it is. I just need to know enough to get them to cardiology. And she used to say, it's the same with legal issues. I don't need to become a housing legal expert. I need to be able to spot that this is a problem that has a legal intervention and get them off to my lawyer. And so that is the biggest thing. But it's also a really, it's tricky to find the sweet spot of how much information is enough. And that's something we're going to talk about in the later half with, like, how do we build an effective training for the audience? The second thing I hear a lot about is just like the workflows. Like, what is the workflow? How do I refer? When am I going to hear back? What information can you share back with me? This is also stuff about like patient confidentiality that comes up, and how are we just sort of like making sure that's all good. And then the last one is something that Lauren flagged, right? Which is the patient legal journey, which is what happens to my patient after I refer them. Like what kind of process are they living through and walking through? How do you determine if they get help? How long does it take you for follow-up? How do you make a choice about the type of treatment? And I found that in a lot of settings I've worked in, the healthcare teams are really curious about understanding this. And sometimes legal teams explain this in trainings, and sometimes they don't. So this is so all of these are opportunities for the legal partners on the call to think with your healthcare teams about, am I training on these things? Am I working with them on developing trainings for these? And what are the opportunities to make these topics more robust in our conversations? If we advance to the other half of the slide, it's about what our legal team members, what I hear at least people say most frequently that they really need help with. So one is just understanding health center operations and common healthcare terminology. So, when we think about this from the healthcare team perspective, you have one new team member in the lawyer or paralegal joining your team, right? You have this one new person who's operating into your ecosystem. For the lawyer, they're walking into an entirely new ecosystem, right? So it's like, who are the different people on staff? What are their roles? Who do I go to when I need this? Who do I go to when I need that, right? Like, the whole environment is often foreign. So doing not just healthcare 101, but like your organizations, your health center or your hospital, your 101. These are the people you need to know. This is how things work here. These are common places we have meetings. You might want to hop into these to come and meet people. All of that is a really big training need anytime you have a new person walking into a new environment. The second one touches a little bit on what Emily mentioned, although I had mentioned specific mental health diagnoses here, it's also broader to physical health diagnosis as well. helping to understand those diagnoses. How does it affect someone's ability to engage with the legal process? So especially with mental health diagnoses, but also a lot of times, how do these different diagnoses affect the legal issue or the legal case that a lawyer might be putting together? So and having trainings that really walk through some of the most common ones you encounter. So if you're working in special education, there might be a different set of really common health diagnoses than if you're working with veterans who've experienced a lot of PTSD, right? So figuring out whatever those diagnoses are for your issue, your population, your setting, and really helping the legal team to understand them. And then lastly, thinking about what training the healthcare team can provide to the legal team about working in trauma-informed ways. So this might not be something that, for example, every doctor or nurse practitioner or social worker who works on the MLP team might be comfortable leading a training on, but is there someone in your health center who can give some training on this? I actually just got to be a fly on the wall attendee at a medical legal partnership in Colorado when they had the director, the doctor who like leads trauma-informed care and is a child abuse specialist, do a training for so not just the MLP lawyer, but did it for the entire legal aid office that they partner with for the MLP. You know, walked through things like how childhood, adverse childhood experiences affect our brain, but then also pivoted into a really powerful and tangible conversation about how that affects clients and patients and ways that we can work with them in trauma-informed ways. One second. So all of these are things, again, to be talking with your partners about and looking for opportunities to really assess what trainings you're already doing and what ones you can build out. Next slide, please. Sorry, my allergies are bad. And so I've taken a cough drop. So if you're gonna, if you hear that, I'm really sorry. So I always like to offer this like level setting when we're talking about training, because we are coming from these different professions with different knowledge, but we're also coming with really different fundamental ways that you as professions have been trained. So if you're a lawyer or a doctor or a nurse practitioner or a social worker, you've spent a lot of time in school. And there's a really big difference in how your schools and your professions train you. And the simplest way I like to call it out is that healthcare providers are trained to the rule and lawyers are trained to the exception, right? So healthcare providers, you were trained to, if A, then B, then check for C, then diagnose D, right? Kind of like follow the path. And you're trained this way so that you can catch the most things possible, right? Follow the disease to its likely path, catch and diagnose as many people as possible, give them treatment that has been proven most commonly to work for them. Lawyers are the opposite, right? If you go to court and you don't have every I dotted and every T crossed and know every case law that proves an exception to the rule, you could lose in court, and that could have really detrimental effects. How this manifests in medical legal partnership is that you're often looking for a very different style of training and looking to present information in very different ways. And it's just really good to be aware of this, because part of MLP training is understanding how your partners are used to learning and bridging this cultural divide. So with healthcare providers, it's tell me the most common way I'm going to see this issue and what I need to look for and how I make the referral. Lawyers tend to train with, let me tell you every possible scenario you might encounter, the history of this law, and how to be prepared for it, right? And they want the same kind of information back. It's not always the most effective when we try to train our partners the way we like to be trained or the way that we are used to be training. And we'll talk about that more in like crafting effective trainings, but I just like to call this out and have us all be aware of it, because it really does affect in the room when you are working to train each other. So if we go to the next slide, this is just sort of grounding us in where medical legal or where training fits in the broader medical legal partnership work, right? And so what is the real purpose of training, right, in these settings? And so the first thing is it's really about relationship building as much as anything. I love Lauren's call out about the experiential piece of this, like being with each other as much as time as possible, observing each other. We should really be thinking about our training activities as spaces to build relationships as much as they are to impart information. And so that affects sort of the cadence, the setup, the content, all of it. If what we're really thinking about is we're trying to get to know each other and maintain that bond and maintain that relationship as much as just the simple, here's what you need to know. The next bullet here is that training should be bidirectional. I saw this in the survey that about half of you are training healthcare only. About 40% of you go both ways. So about 40% of you are doing bidirectional trainings, and then about 10% of you don't currently have training activities. And so I see this, I think this is really common in medical legal partnership. We come in and we focus really heavily on the training for healthcare members, which is important, but it's only half of the partnership. And especially if we look at it as relationship building, right? Like we are all in this environment as learners and we are all in this environment as teachers. And so really making sure that when you're prioritizing training activities, you're really looking to both sides of this partnership. On our next bullet, we'll see that, and this is one of my favorite things to call out, that training, like we have to sort of reimagine how we think about training in the MLP world, right? So it's both formal and informal. I think sometimes when we think about training, we think about what we're doing right now, right? We've blocked 90 minutes of our day. It's kind of formal. There's a slide deck. And yes, this is a training. And there are times when that is exactly what we need to do a deeper dive into a topic. But training is also that 5-minute curbside consult that you do. So if anyone on the call is not familiar with that term, curbside consults are when a healthcare team member reaches out to the legal team and says, hey, I have a patient I'm thinking about referring. I don't know if it's a good fit. And without sharing any like personally identifying information or protected health information, just kind of walks through a general thing and says, is this right? Or has a broad question, right? Like, the COVID moratoriums are ending on housing protections. Like I have a lot of patients that affects. What's going to happen? Like what's going to happen? What can I do? Right. So both of those like formal, we have an audience, we have a slide deck, those are training, but also all of those moments, those curbside consults, those times you grab each other in the hall on passing to just say hello and ask a quick question. The times you drop into an existing staff meeting and just say, hey, I just want to remind everyone I'm here. This is how you make a referral. All of those touch points are training. And so we really want to have this broad idea of how we think about training. And then the last bullet on this page is that trainings are ongoing. And this is really important. It's never one and done. So staff are going to leave and new staff are going to come in who need to hear the same information, or staff are going to stay around and it just needs to be reinforced, right? So for our healthcare team members, this is a small part of what they do in their day. They have 100 other things they're thinking about, and just hearing about those workflows or hearing about that issue once may not be enough. And same with our legal team members who are hearing about a new workplace, a new system, new diagnoses. Those things need to be reinforced. And so trainings are building blocks and not they're not endpoints. So if we go to the next slide, I wanted to just touch base really quickly since we're talking about these short and long trainings and things being ongoing, just to flag some common MLP training venues and scenarios. And so you'll see that from the top to the bottom, it increases in formality. So the least formal are at the top, the most formal are at the bottom. And if there's one piece of advice that I could give about sort of how you select where you're going to do trainings and when you're going to do trainings, it would be to really meet people where they are. And I mean that literally and metaphorically. So usually if you're trying to engage any audience, the best case scenario is not to like schedule an additional meeting that wasn't on their calendar before that they now have to show up for. It's figuring out where do they go and have conversations at all the time. And how do you fold yourself, whether it's 5 minutes or 30 minutes, into that existing meeting, into that existing environment. So it's like becoming part of their routine. And so one place to do that is those curbside consults, right? Like making yourselves available to each other to just have those 5-minute touch points. So I've seen some MLPs do this really informally, which is like, if you want to do a curbside consult, here's my email, here's my number, just reach out anytime. I've seen MLPs set up like an actual online, so through whatever your like online systems are, a way to ping a request either direction, right? To say like, hey, I've got this client, or I have this patient, I have a question, you know, let's set up a time to grab 5 minutes. But that's the first thing. Another is funneling information through clinical champions or through the legal team champions. So, right, so like sharing a piece of information and having that person present it out at whatever their next like huddle or meeting is, whether it's on the legal or the healthcare side. A lot of MLPs have office hours. Some people call it different things, but office hours are basically just whenever it is that you huddle regularly to talk through things like open cases, to do trainings, to talk through workflow problems, to talk through curbside consults. A lot of MLPs will do this every other week, just kind of have a time on the schedule, open it up to anybody who makes referrals, and then obviously have the clinical champions there and the legal team there. I've seen a lot of MLPs that do this bi-weekly and say, we're going to have 30 minutes worth of training. We're going to rotate the topic every week. And we're going to do that after we do 20 minutes of, or 15 minutes of case check-ins. Another venue is thinking about clinical team meetings and huddles. So where are the social work team already meeting? Like, where do they huddle every week? Where do the department, like physicians, huddle every week? Can the lawyer come in and do 10 minutes? And then all staff meetings. This is a great way to think about reaching out to the legal team, because a lot of times trainings should go beyond just the MLP lawyer, right? Like, can we do a training that is going to reach the entire legal aid organization? Because a lot of times those folks are working on the MLP cases, even if they're not interacting with the health center staff all the time. So can a social worker or a doctor show up at a legal aid all staff meeting and just provide some information there? We want to think on really big scales, right? Like what information about the MLP is being shared at employee orientations and onboarding? Like, are they getting any introduction to that? And then the last one is an example of what we're doing right now, right? Which is to say, okay, we've got this really big topic. It doesn't fit. It's going to be a longer training. It doesn't fit into any of our current meetings. So we're going to schedule that standalone training session, or it might be a rights training for patients. And we're going to find a different time for that. If we move to our next slide, this is where I wanted to flag some resources for you. So there are already both some like training advice for MLPs that exists in the Health Center Toolkit. So that's the first resource here. And I think Reha is going to throw that in the chat for you as well, but you can also scan that QR code if you want to look at it on a mobile device. This has a lot of the information about training venues and selecting training venues, and just like principles of good MLP training. I also wanted to share some actual sample trainings that you can adapt. So these were actually created, and I helped to create these for the Kaiser Permanente Medical Legal Partnership, and these are brand new resources. So the second one here is the patient MLP legal journey training. There is both a job aid and a slide deck, so a PowerPoint slide deck, and we can put that in the chat as well. I saw it coming through. This is the equivalent of about a 20-minute training. I think it's like maybe 6 or 7 slides, and it has an accompanying job aid, which is like a PDF you can take away at the end of it. And it walks, it's meant to walk people through what happens after a patient gets referred. And just so folks know, I often get the question, like, can we use these and can we adapt them? And the answer is yes. You can change the slide decks if there are anything that's like different about your local procedure that you want to change, you can edit those slide decks and just use them. So the National Center for Medical Legal Partnership, Health Begins, and Kaiser Permanente, who are the authors of these resources, are encouraging everyone to use them. So that's one. The second or the third resource here is a sample workflow training. So for both when you're training the legal team and the healthcare team about like how you communicate, how patient referrals happen, how follow-ups happen. There's also some information about confidentiality in there. This is the same. It's a PowerPoint slide deck that you can download, you can edit, you can make it your own, and you can build on that. So we can throw that one in and Ray has ahead of me. They're already in the chat. And then this last one is actually a whole series, and it focuses specifically on housing because that's the focus of the Kaiser Permanente project. But with that training series, this is about helping. It was designed to help healthcare teams identify common housing issues, know when they need to make a referral, and make the referral. I think there are 9 trainings in the series, and every single one of them is designed to be 15 minutes long with a 5-minute Q&A afterwards. There are slide decks for each of these and guidance on how to use them. And you are welcome, if you work in housing spaces, to just take these trainings, use them, adapt them. But they are also, if you work in other areas like special education, if you work in family law, if your partnership works in public benefits, they really kind of provide a flow and template for these like really short 15-minute, how do you help a provider know what they need to know about this issue, and then get it over to the legal team. So I know there are other topics that we talked about in terms of like training priorities, but these are ones that have some really tangible resources that if you're looking for, to do maybe a lighter lift and adapt something, we really encourage you to check these out. And if we can put that last resource in the chat, there it is, the housing training series. You'll see that it has all the slide decks. It has guidance on how to use them. It also has the data from the project in which these were all used. So if we go to the next slide, I want to take an opportunity here to hear from you all again and have you, raise hands and unmute here. I want to hear about, is there a training topic that's been really valuable for you, or a training you've instituted that's been really beneficial? Is there a training tip or a training practice that you have found to be really, really helpful in your medical legal partnership? Or is there a venue? Like, we had the whole list of venues. Is there a venue that you've found, like, we have our most success when we train at fill in the blank place? I see Callie has a hand up. Callie, if you can unmute and share with us and where you're from.
Yeah, hi, I'm Callie. I work at Nationwide Children's Hospital and the managing attorney of our medical legal partnership, Lawyers for Kids. We have both hospital employed attorneys and a contract with our local legal aid organization, and we partner to do presentations to healthcare providers. And since COVID, honestly, we have been doing our monthly or bi-monthly lunch and learns completely online. And we just send the invites to everyone with our partnership, with other partnerships. And we have steadily increased our attendance. And we just had one this week where we had 190 some clinicians attend, which we were really proud of.
That is amazing. That is amazing. Thanks for
do
sharing
think,
that.
I mean, we do go to staff meetings. We'll go in person if anybody wants us. But honestly, they don't. I mean, they do sometimes, but our experience is when we do live trainings, we get a quarter to an eighth of the attendance that we get for virtual trainings. Our providers are super busy, and it usually works out perfectly to do it over the lunch hour.
That's great, Callie. Thank you. And I think that's a really good example of adapting to what the people want, right? So if people are more likely to come virtually, and you can establish, it sounds like you have a monthly meeting. So if you can establish that cadence virtually, it's, a lot of medical legal partnership, the sort of ability to see each other took that hit during COVID, because for teams that were on site a lot and seeing each other in the hallways, trying to really recreate that in a virtual environment. And sounds like you've done that really well. I see that Lauren also has a hand up. Lauren, if you'd like to unmute.
Sure, thank you. One thing that we do, and this is part of our trauma, kind of bi-directional trauma-informed practice, is once a referral comes in, and before we do intake, someone on the clinical staff sits down with our attorneys, and we talk about what the diagnosis of the child is, what it means, what life-limiting complications may be associated with it, and how this might impact multiple areas of the child's life, of the family's life. And then it's really nice for a clinician when we can to be present during these intakes. And that way, if questions come up, we can answer them. The attorney language and process around the intake is very careful, especially if it's a sensitive medical issue. And the whole experience, I think, builds trust with families when everyone is understanding each other's language. And we also have found that this is a time when families get education about what their child, what the diagnosis may be, and how this might impact multiple areas of their lives. So,
thanks, Lauren. I love that. I love that because it's taking training out of this. The way you described it is it's taking training out of being this like other thing that we do over here on the side, and you're building it into the patient interaction. You're building it into the intake. You're building it in to the warm handoff from the clinician to the lawyer. And I think that's a really beautiful example, not just of training, but of the integration of how the partners are working together. And you're doing it on, it sounds like you're doing it on every, it sounds like you're doing it on every case. And so it builds that muscle over time. And I love that you're the first site I've ever heard of doing it quite like that. And I love that. Awesome. All right, if we go to our next slide, I want us all, so we're going to use the regular chat box for this, the regular webinar chat, not the Q&A box. And so I'm going to read 2 prompts out loud. So I'm going to start a sentence and I want you to finish it in the chat box, and I want everybody to do this. And all you have to do is respond with the first word or phrase that comes to mind. Because we're going to switch now and talk a little bit about sort of effective learning and like how we think about training different groups. So fill in the blank to this sentence form for me. I learn best when. Fill in the blank. I learn best when. Oh, Bethany, I think that says the chat is disabled. Are we able to enable the chat?
Yes, let me ask everyone to go ahead and test it. My apologies, everyone. Thank
I
you.
think it's working now. I'm seeing a few answers come in. If we could try again, let's try that.
Thank you.
Awesome, it's working now. So first word or phrase that comes to mind, I learn best when. And I'm going to give everybody a minute to answer, and then I'll read some of these out loud into the room. You can also follow along in the chat box. So I learn best when doing, when it's late at night. I learn best when writing. I learn best in community, when it's interactive, when I can read what I'm learning, when it's interactive, when I can work through the skill on my own with guidance, when I can interact, another interactive, another answer for writing and reviewing, when it's a discussion and not a lecture, when I'm in safe spaces, and when I feel heard. Thanks for sharing, everyone. All right, I have one more prompt. Yeah, one more prompt. So on the flip side, I struggle in trainings when fill in the blank. I struggle in trainings when I'm going to read these out loud as well. I struggle in trainings when they are disorganized, when a lot of information is given all at once, when I feel overwhelmed, when it's just PowerPoint, when I don't have a point of reference to start from, when the presenter doesn't break down unfamiliar terminology or concepts, when I don't know the why, when there's too much information on the screen and not enough context, when there's not enough information provided, when I'm told the information without something to refer to, when there are no stories or no examples provided, when there's too little information given or it's too basic, and when there are no audio visual aids or something to break the monotony. Yeah. Thank you all so much for sharing this. If we move to the next slide, this is what I love about your answers is that you have all, in your reflections, done two things, which is really highlighted how people learn differently, right? Some people were asking for visuals and writing, and other people were asking for interaction and experiential things. Some people wanted the things in writing as follow-up, and some people wanted less writing, right? So it really highlighted that we all learn a little bit differently. But on a whole, what you also did is really highlighted basically all of the principles of adult learning. And so I just wanted to walk through these and call these out. I think that these are things that I'm guessing most people on this webinar already know, even if it's just instinctually or when you think about the way that you learn. But as adults, we learn best when we use our own experiences as a resource. So that means we're building on our existing knowledge. So when we go to a training, it means we're being asked questions. It means it's starting from what we know and building on it and not starting us over at zero, but also not starting us too far down the road. So this goes a little bit to the interaction piece, but it also goes to we're able to share our own thoughts, experiences, etc., and make that part of the learning experience. The next bullet is that adults learn best when the material is immediately relevant to our lives. So we have to know, so I think someone put in the why. So like we have to know how the material fits to what we're doing and how we're going to use it quickly or immediately in our lives. We've got a lot of stuff going on, in our work and in our lives. And if we're going to go to a training, we want to know, or have a learning experience, we want to know how we're going to use it. The next bullet is that we learn best when the material is problem-centered. So it's tangible. So this means we're using real-world scenarios and case examples. This is incredibly relevant in the medical legal partnership world, right? And I've heard a lot of you talking about this, right? You're using a real patient or a real patient's legal need to kind of walk through the process or to ask the question about the diagnoses, et cetera. So really relying on those real-world examples. The next bullet is that we learn with our senses. And from the chat, I can tell different folks learn better with different senses. I happen to be an audio learner. I can't remember anything I read, but if I listen to an audiobook, I can recite it back to you after the first time I listen to it. Can read the same book and I'll forget the whole plot a week later. That's not common. That's not true for a visual learner, right? And so the takeaway from this is that the more ways we share the material, the better it's going to be for a group. So sharing something, having something that's visual, having something that's audio, having something that's tactile or experiential, the more we can weave in elements of all these things in any training scenario, the better off we are. So if we go to this slide, this is the way that I think about how, like, no matter what the topic is, no matter who the audience is. So we can be talking specifically about MLP here and health and legal audiences, but I apply this to literally any scenario where you're going to train anybody about anything. This is the framework that I use to think through the steps. And so there's two things I'd love for Bethany to toss in the chat right now. The first is a link to a resource on my website that has this graphic. So we're not going to, it's an interactive graphic on my website. We're not going to do the interaction here. I'm just going to talk through it. And then the second one is a link to a resource I developed with the National Center, which is actually an MLP training design worksheet. And all the things that we're going to talk through on this is an actual worksheet that asks you the same questions and helps you think through like building content for a training in this order. So the first thing whenever we're thinking about developing a training is to really go to this top and think about defining and understanding the audience. So before we ever think about what the content is, we have to really unpack who we're talking to. And that's to the and that's to ask ourselves several questions, right? Like, who are they, right? Demographically, professionally, like if we're talking about working with like a know your rights training or something for patients, what neighborhood do they live in? What language do they speak? Like, what are all the things that we know about them in that sort of demographic kind of way? Asking ourselves, what do they know about this particular topic? What's their starting point, right? What's the way that this audience learns best, right? Is this audience really used to like, diving into case studies? Do they learn best through story? Do they learn best through activities? Do they learn best in having something written that they can reflect on? Like, what is the way that this audience typically learns? And how do we meet them where they are? Which is like, where are they going to be most receptive to this information? Is that having, as Callie called out, an online lunch session virtually once a month where people can drop in? Is that showing up to a pre-scheduled meeting? Or in the case of like patient-client trainings, know your rights, is it going, not asking them to come all the way to the hospital or the legal aid office, but is it going to a place in their community where they don't have to commute as far and that feels more comfortable and safe for them? So what do we know about them demographically? What do they know about this topic? How do they typically learn? Where are they going to be most receptive to hearing information? The more we can answer all those questions and think about that in the design of the training, the more effective it's going to be. So we want to be able to have answers to all those questions before we ever start thinking about actually building specific content. Then when we get to the content of a training, I always think of it in 3 steps. No matter whether you're doing an hour training or a 15-minute training, we have to engage, inform, and invite clear action. So starting by engaging is sharing why this topic is relevant to this audience or why it's urgent. So urgency is often a really big thing, both in communications and in training, which is like, why do you really need to know this now? So sometimes if you're of the legal team and you're training on a specific legal issue, right, to spot what's changing. I had mentioned, I know we're past it now, but when the COVID moratoriums first ended for housing, that was a really big thing, right? Like you're about to see a massive influx of people who are going to get eviction notices. So it's time sensitive, it's urgent. You're going to see it coming in. People are going to be talking about this. So that's the urgency piece, right? Or in this case, talking about like, how does it affect someone's job or their patients? And engaging, so the tools that are most helpful for engaging are asking questions, right? So not starting with talking at people, but asking them questions about how this shows up in their life, about what they know about the topic, or telling stories are really the 2 most helpful things to sort of engage people in a new topic. The second thing is informing. And I like to think about it as like not giving people too much information, but not giving them too little. And so on the worksheet, you'll see it's identifying what's the 3 things this audience needs to know, right? Just 3 things. Like what's the 3 things they need to know to whatever your training topic is on, to do their job, to understand the issue, to resolve a problem, or if you're, again, training patient clients to help themselves. And that housing training series that I flagged a couple slides ago when we were talking about, they're pre-built, they're 15 minutes long. It really follows this exact thing. So it starts with an engaged activity or topic or slide, and then it goes to the inform. And we really thought about it as whatever that housing topic is, what are the 3 things providers need to know to be able to identify this issue in patients? And so kind of like naming those things. And if we think about stories and asking questions as being the things that help people engage with a topic, then the things that help people better understand or break down new material are things like using familiar cultural cues, using metaphors to someone's existing work life, right? Or things that they are already familiar with. It kind of goes on that building on it. So if you can take a new topic and communicate it within metaphors or cultural cues that someone's already familiar with, it's going to help that make it that much easier to process. A lot of times in the MLP world, I'm always trying to equate when we're talking about different legal issues, what is a legal issue that needs legal primary care and what needs legal emergency room. So, that's just like sort of one very small example of that. And then this is true for any time you're communicating about anything, but also anytime you're training on something, is that there should be some sort of inviting clear action at the end, and offer people really clear directions for the steps that they can take. So again, if it is a client or patient that you're doing training with, it's like, when do they reach out for additional help? Where do they submit a form? When do they send something to their landlord, et cetera? It's like, I often for this encourage people to think about if, when formats of speaking. So if this, then do this. And it's the same kind of thing with, like, if you're talking about a legal issue, if you see this, refer them to the lawyer. If you see this, do a curbside consult. So it's kind of like just really clear instructions that are really easy and tangible for people to follow up on. And then if we go to our next slide here, this is really the last one that I wanted to walk through with you, which is just sort of like a recap of some of those things within the context of MLP training best practices. And we've talked about some of them, but there are more here. A couple of new ones here, which is one, again, to meet people where they are. So if you're the trainer, you want to go to wherever the trainee wants you, right? Well, that works in both directions of the partnership. If you're the one who has something that you feel you need to impart, then you need to adapt to where the person who you want to listen to it wants to be. It's true for both sides of the partnership. It's true for patient clients. And also, though, that also means meet people where they are in terms of what they already know about the content. I loved the call out in the chat box about it's hard to learn when I don't know the terminologies or I don't know the framework. There's a lot of alphabet soup. There's a lot of new systems in this, and we have to really take the time to, walk our partners through that. The next bullet is to really seek input from each other to co-create and co-lead sessions wherever possible. So there's a thing in communications that I talk about a lot, where if you survey a group of people, it doesn't matter who the people are. It doesn't matter their demographics or anything about them. If you ask them, who do you trust the most? The answer is almost always someone like me. Right? So we trust people who have shared experiences with us, whether that is shared identities, or it's like shared professional experiences. We take information differently from somebody who has walked a similar path or does similar work than we do from an outside source. And so that means that the best messenger for legal information isn't always a lawyer. Sometimes it's a healthcare provider who's used a service and is like, oh my gosh, this was really, let me tell you how it changed my work life and how it helped a patient, and vice versa. Sometimes if you're trying to get lawyers to listen to things about the healthcare system or why it really matters, hearing a lawyer say, this is why it was so important to my practice. Like, I had to know X, Y, and Z to be able to do this, and passing that information along. And so thinking about in the trainings, how do you invite someone who represents the audience to share their experience, to share a positive referral, to share about how knowing those mental health diagnoses helped you work with a client, et cetera. And if you're building the curriculum for a new training, even if it's just short, run it past the other side of the partnership. You should never walk into a training in front of an audience that you haven't, an MLP audience that you haven't run through through your teammates, right? Because that's what we really are. We're teammates in this work. So the next bullet is to lead with questions. So we talked about that as being one of the ways that it's really important to gauge people. And it's also one of these principles of adult learning. So we all learn best when we are doing it through the lens of our own experiences. So engage partners by asking them about their experience with an issue or a problem, and prompt them to see how the info you share helps with their existing work or their existing goal. The next one is that less is often more, right? So this goes both to the content of a training and also sometimes the timing. So only share, if we go back to one of those really early slides, and that the purpose of training is as much for relationship building, and we're looking at this as like a long-term endeavor and not a one-off training scenario, then we really should feel empowered and encouraged to only share what someone needs to know in that moment, like incremental bits, right? They don't need to know about everything about the mental health diagnosis or everything about the legal issue. It's just what they need to know in that moment, and have them come back for more, and think about this as a long-term relationship building thing, and not a, I must tell you everything I know because I may never talk to you ever again. So that really goes to, it's a building block. And sometimes we do learn better in short, like 15-minute chunks than in 90-minute sessions. And I'm fully aware that I'm saying that on a 90-minute webinar. And then the next bullet is about, it's what we were just talking about. It's short and frequent is often better than really long and one-off. Okay, next. Oh, there's one more. Learn each other's language and culture, right? So this is the experiential piece. This is learning the acronyms. This is learning who's who in the building, doing really unsexy things like looking at each other's org charts, and just like, what are the cultural norms for communication? Like, how do we reach each other best? And just and helping each other to understand the system. So that's where the patient MLP legal journey training comes in. That's where really doing health center or hospital 101 with your legal partners is helpful. Because if we don't have that foundation, then everything that we build on top of it can really be a bit of a struggle. So I think that brings us like to the end of the sort of prepared portion of this. And I really want to open it up generally to Q&A. If you have any burning questions about training, or if you have additional experiences that you didn't get to share during one of the earlier prompts about something that's working really well that you wanted to share with folks, now is the time to raise your hand and ask. And if there were any resources that we were putting in the chat that you actually want us to bring up on the screen and walk through, like, you can also ask for that as well. So use the Q&A or raise hand. I see Callie, you've got a hand up. Oh, it went down.
I was going to type it in the Q&A, so I didn't have to talk. But I guess just a quick question, if you have any tips. Our legal aid partners, we have 3 dedicated attorneys who work with us in the MLP and know what we're doing. But we also, when we do trainings, we rely on others that work at legal aid to do those trainings for clinicians. And sometimes we struggle with getting them to understand the level of detail that they need to go into, very much like you said. I guess just any quick tips for somebody who might not do this full time, but is going to be presenting to a clinician-based audience.
Yeah, so if I understand it correctly, you like you said, you have 3 MLP attorneys, but other people from their legal aid offices who may be specialists in a specific topic come and train the healthcare team.
So, reentry or tax or
Yeah. Okay. I would say a couple of things. I would say if you can give them, so part of this is having your legal aid partners, so those 3 lawyers, really sort of give them whatever 101 they need about engaging with the clinicians, like making sure that that's happening, I think is really beneficial. I think the second thing is if you can give them a sample training of something that's already built, and even if it's not topically related. So I think pulling down one of the housing trainings and saying like, listen, this is kind of a format that we know works well with healthcare providers. You'll notice that it kind of, and the legal team can do this, but with their colleagues, but saying, listen, this is 15 minutes. You'll notice it's got a kind of why it matters, and then the 3 things we need to be on the lookout for, and then what we should do if we spot it, right? And then just move to open Q&A. And so I think sometimes with the legal teams, if they have a template to work off of, even if the info isn't set, that can be a really strong way to say like, this is what works. Anything more than this is too much. And then lastly, I'd say if it's a possibility, although I know it then puts burden back on the healthcare team, if the healthcare team can then take whatever like one person from the healthcare team who works on the MLP can take a look at that in advance and say, and circle things and say like, oh, this is way too much. I don't know what this means. I don't know what this means. And you need like 5 slides, not 27 slides. Like just even to do like a quick round of feedback before they get in front of a room, I think is really, really helpful.
Thank you. Those are all helpful. We've tried some of that, but not all of it. I appreciate it.
Kate, in the chat, we have a question posed by Sharon, excuse me, Sharon Grady.
Is this Sharon, is this a practice that you've used, or is this a question about how to use data to tailor your training? Just a suggestion. Yes. So Sharon has a great suggestion in the chat box, which is using any data that you have to tailor your training in 2 ways. So both using data you have about frequent referrals. And I think it can go both ways, right? Like, so what you're getting a lot of referrals about, maybe where the most interest or need is. So you might do some additional training. It also might be the inverse, right? If you're getting a lot of referrals on one topic and none on something else that you know is pretty prevalent, it might be that folks don't know you take the referral, or folks don't know that the referral is possible. So there's a lot you can see from the data. There's also nothing wrong with like circulating a 2-question multiple choice survey to like all the folks on either team and saying, here are some potential topics we're thinking about training on. What is most interesting to you? And just having that sort of ranked. But yes, data can be a really big help, and also want to make a plug for doing some really simple evaluation of trainings, like 5-question post-training surveys, giving people time during the training to answer them, so you know what's going well and what's not going well. So you know things like that was 90 slides and it was way too much information, et cetera, can be really helpful. It's a great suggestion, Sharon. Thank you. Other questions, either via the chat or raised hands? Yes, I see a hand just went up. I'm searching to find it. Jessica, if you want to go ahead and unmute, love to hear your question or your suggestion.
Yeah, I just wanted to offer a thought on this as well. So one thing that's helped in trainings that we do is we do a quiz at the end that's essentially just a few short questions to see whether or not I've taught them anything in the training. And so that's helpful when building the training to be like, what are the few things that I really want to make sure the providers take with them from this training? And so as long as I have hit those points in the training, I think that's a good way to say, okay, well, maybe some of that extra stuff is good, but maybe I don't need all of that in the presentation. So I just wanted to suggest that, because I often see too, especially when training the residents, they are proud of themselves when they answer those questions right. And so that's a good way too to, make them feel a little bit better about a very busy day when they did great, remembering the couple of things that I really wanted them to hone in on.
Yeah, Jessica, I love that. First of all, I'm all for celebration and motivating and just being excited about the steps we're taking. So I love that. I also think I heard 2 things that I want to uplift from what you were saying, which is that both you use the training to see, like, did I get the points across or the evaluation to see, did I get the points across I want? But if I think I heard you, it's also a way of like, if you craft that evaluation to say, ask 3 questions or ask that quiz at the end, and whatever you think you want people to be able to answer in those quiz questions tells you what's most important when you're building your training. Which sounds like that's a really good, like, belt and suspenders check as well. Awesome. Thank you. I think we have time for 1 or 2 more questions or share outs if folks have other things that are front of mind right now. Well, I would say for takeaways for today, or the things I'm hoping you all walk out of the room doing is, I hope you go back to that sort of that list of when, I know Bethany will share out we can stay where we were. It's okay, Bethany. I hope you will all, when you look at the slides later on, I hope you will look at that list of the sort of opportunities and topics and real training needs for each group, and really think with each other about, like, are you meeting each of those topics, and to talk with your partners about where those other opportunities really exist. I hope you'll check out some of the resources and see how they apply to you, even if you're not going to run those trainings. How can you sort of build on them? And I'm going to put into the chat, I know that you all have Bethany's email and the National Center's email address. I'm also going to put mine in. If you find that, and putting it in the chat box for everyone right now, if you find, you wake up tomorrow or in a week and you had a question that just didn't come to you here in this session, please feel free to email me and I'll be happy to answer it the best that I can. And with that, I'm going to hand it over to Bethany, but thank you all so much for your engagement and energy and attention today. It was really a pleasure to be here with you all and to learn from you. I jotted down several new tips that I'm now thinking about. So thank you so much. And Bethany, back to you.
Thanks so much, Kate. Also want to thank everyone for continuing to participate in this interactive virtual learning series with us. As is the usual, we want to make sure that people also know how to continue to work through those series is by referring to this Health Center MLP toolkit, which really is built with multiple types of healthcare institutions in mind. So grab that URL in the chat as well as in the slide deck when we share it, and bookmark it. And then also, if you are working with a health center, or if you are health center staff, if there are really super technical questions, the Bureau of Primary Healthcare has advised us that you are encouraged to and welcome to reach out to them using their program support contact form. So that is also hyperlinked in the chat to assist you. Also, we are very, very happy to finally announce that next week, folks will be able to access a very high demand resource pertaining to sustainability and performance measurement for their medical legal partnership. So when we first developed the Performance Measures Handbook, it was developed when the MLP landscape was super heavy hospital based and driven. And so now we're in a place in the MLP movement where we are much more diverse in terms of healthcare institutions that have adopted and systems that have adopted the MLP approach. And so we decided it was time to run a learning collaborative and develop a resource specific to the health center MLP model. But we do think the content that you'll see coming out next week is also applicable across settings. So look forward to the medical legal partnership update next week when we provide a link to this much needed resource for the field. Join us again next week where Kate Marple will be back with us to help you all understand how to ditch the pitch, right? How to develop that effective messaging. Speaking of sustainability, messaging, right, that's effective is really important to help address the needs of your growing audiences, including stakeholders. So I want to thank Kate again for joining us on today's session 8, as well as for everyone who continues to join us throughout this entire webinar series and interact, right, as learners. Register on the website to join us next week. And you all will also see Rahab back online when her Wi-Fi is working to help remind you about where these resources can be found. This is the website on our medical legal partnership webpage. You will see under resources the entire PIP webinar series, and you can see that after Kate helps us learn more about messaging that's effective for MLPs, then on the 20th, we'll actually be joined by Philadelphia Legal Assistants to talk about their two health center MLPs that they work with on OUD and SUD care, and how they are specifically screening for and addressing the legal needs of that patient population in the city of brotherly love. So take a moment to, and we'll share this as well in a follow-up message, to register for both of these upcoming webinars. And then we're actually going to close out the webinar series with a more open listening session to hear from everyone. So look out for more information about our June 27th listening session. Finally, as perhaps most relevant to what we learned about today, it's important to hear from you all about the effectiveness of the trainings. So take a moment to use that URL code, and we'll be following up with everyone here to fill out the Survey Monkey that we use to find out how well we did today, and what else you need to be able to meet your training and learning needs. So take a moment, use that URL code, and then thank you so much, Kate, for sharing it in the chat. You can also use the link that's in the chat to directly access our evaluation. With that, we are at the end of session 8, all about crafting those effective trainings for your MLP healthcare workforce, and quite frankly, the entire team that is engaged in medical legal partnership practice. Another thank you to Kate Marple of Who Tells the Story for joining us today, as well as our partners at Texas A&M Institute for Healthcare Access for helping us craft this webinar series. Thank you all. We'll see you again on the 13th and again on the 20th for additional training. Closing out today. Take care, everyone.